So, Dave, you had a front row seat to the implementation of the Affordable Care Act, Obamacare, many would call it. And you've watched, as we all have, as the Trump administration has really tried to dismantle that program. Through both administrations, I think, however, we've seen as consumers' healthcare costs go up. So there were and have been a lot of promises of cost savings. We haven't necessarily seen them transpire, any of us. So can you talk a little bit about your perspective on this issue and what we as consumers can hope for from healthcare costs in the future?
I have been one of the statewide leaders that's been leading the implementation of healthcare reform, literally from the moment I was sworn in as insurance commissioner, where I issued an emergency regulation requiring the insurers to put 85 or 80% respectively of their premiums into actual healthcare. And healthcare reform, while not perfect, has helped a lot of people in California. We've insured 5 million additional people who didn't have insurance before. And most of them are getting a significant subsidy. If they're on Medi-Cal, these are very low-income individuals who otherwise were not getting any health insurance. Now they're getting Medi-Cal at a very, very, very subsidized price, in some cases for free. And if they're buying through our exchange, about 85% of the 1.2 million individuals who are buying through our exchange are getting a dramatic subsidy as well as limitations on their out-of-pocket costs. So it did help a lot of people. Some people did experience insurance price increases. If you're someone that makes more money than people that were eligible for the things I've described, you might have seen a health insurance rate increase. Now, I've tried to get legislation and a ballot measure passed to give me the authority to regulate those rates. That sadly was not a part of the compromise of the Affordable Care Act, so I tried to get that enacted here in California. And unfortunately, the health insurers spent $50 million lying about the ballot measure in 2014 up and down the state, and so the voters didn't enact it. So that is one of the missing pieces of the reform, is actual direct regulation of rates. In terms of underlying medical costs, initially in the Obama administration, in aggregate, there was a slowing of the increase in aggregate medical costs, but that effect seems to be wearing off, particularly as the Trump administration tries to undermine healthcare reform. We're starting to see medical costs begin to go up again, and they drive health insurance rates. So not perfect. My own personal view is that we ought to move to a single payer system, a system where you have one payer for medical care for everybody. You take the profit taking out of the system, you take the administrative costs out of the system, you take inefficiency and waste out of the system. And we see single payer work reasonably well with regard to the Medicare program for seniors. Since its implementation, seniors have had much improved access to medical care. And so we know in every other industrialized country in the world, that's how they do it in various ways. And I think that's what we should do here ultimately in California. But in the meantime, we're in a pitched battle with the Trump administration trying to protect the benefits of healthcare reform as they seek to undermine it, and been very active in that front, battling the Trump administration, doing everything we can to protect the benefits of healthcare reform that we have in place here in California.
Yeah, Dave, just stick on that subject for a minute. You have a big grassroots following up here in Northern California, and I think a lot of that is for your take on single payer and Medicare for all. I'd like to understand a little more from a city or county perspective what that would do for cities and small business when they no longer have to cover the cost of those employees, and what those budgets would look like from a city or county standpoint if we did have a Medicare for all system. I would think it would help the situation for city and county budgets. Am I naive to think that, or especially with the huge cost of workers' compensation insurance and some of the other things?
There's no question that when fully implemented, single payer would provide tremendous savings to cities and counties and other public agencies that are providing health benefits for their employees. It would also be a big boon for small, medium, and large businesses who, everywhere I travel in California, complain about how expensive health insurance is. I mean, even for large businesses where they have a little more bargaining power with the health insurers and the HMOs, fundamentally, they're really not able to bargain. They have to take the price that's dictated to them, and that price builds in a lot of profit, a lot of inefficiency, a lot of overhead. So there would be substantial savings. It really depends on the generosity of the local government and the business with regard to its current health benefits package. But suffice to say, there would be significant savings and ones that are well worth the effort. Now, in order to fund it, though, you are going to need some additional revenues, and that's been a sticking point in the past, but I don't think that needs to be fatal, and you're going to have to do some things to try to control underlying costs, so that's an important aspect of it also. But again, every other industrialized country in the world has figured this out. The United States has figured it out for the Medicare program, and I'm confident here in California we can figure it out too, and it would be just so much more beneficial, would reduce inefficiency, reduce all of the middle people that are in the middle between you and your physician or your healthcare provider, and that's a benefit as well.
Yeah, well, I was thinking too along the lines of, I'm speaking for as a labor worker, and I mean, we might get a raise here and there in subsequent years, but it seems like those are always offset by the health insurance increases that are put down onto us. And we understand that the business or the government agencies end up taking some of that hit, but it's very hard to grow economic wealth here or get a better salary when continuously those things are offset by the increases to the healthcare.
Absolutely. As I travel around the state, I hear time and time again from both employers and labor organizations that any increase in compensation that might be bargained for or offered to employees gets eaten up by rising health insurance and HMO costs. So that even if you're fortunate enough to be in a union, and in a union that is able to negotiate increases in compensation for you, much of that, if not all of it, gets eaten up in the rising costs of health care and health benefits for workers. And same with non-unionized employers where small, medium, or large are offering, say, health insurance or health benefit packages to their employees. They make a choice between keeping up with the rising cost of health care or putting a little more money into the paycheck of their employees. And increasingly, it's having to put more money into the health care in order to maintain the same level of benefits. And oftentimes, the benefits get cut on top of that to try to cover the rising costs. So it's a huge problem. It's one where there really is no end in sight. The notion that health insurance, health care can function like a purely competitive market, I think is one that we've seen time and time again doesn't work. And part of it is just opacity. If you want to have a market work, you need to have pricing and people need to know what the price of things are. You can't find the price of medical care to save your life right now in California. So how can a market possibly work where price is available, people can make choices, there's competition? It just doesn't function that way. And that's why so many other countries have gone to single payer and why we went to single payer for the Medicare program.
Mm-hmm. And speaking of market and competition, we do have a gripe up here that there isn't a lot of competition. I mean, there's just some companies that just won't come up here to cover people. How would that be addressed in a single payer Medicare for all sort of system in California? Would we get some better competition up here?
Well, you wouldn't have to rely on a decision of a Anthem Blue Cross or a Blue Shield or a Kaiser to come into Northern California. Under a single payer program, there'd be a single entity that would be responsible for paying for medical care provided by medical providers. And so you wouldn't be at the mercy any longer of the insurer's decision. And sadly, with the new Trump administration, one of the first acts President Trump took was to sign an executive order directing federal agencies not to implement or comply with the Affordable Care Act. And he's done a bunch of other things since then to undermine it. So some number of health insurers have said, that's it, we're out of here. We're not going to participate any longer. So Anthem, for example, pulled out of a lot of areas in the state of California that it was in previously. Under single payer, you wouldn't be at the mercy of the health insurers and the HMOs with regard to whether they want to come into your area or not.